Hi, I'm Dr. Katie Swanson.
And I'm Dr. Taryn Weil.
And I'm Dr. Stephanie Klostra.
And today we're going to be answering some of the most asked questions for pediatric dentists. So a pediatric dentist is a dentist who has completed not only their general dentistry education for 4 years, but also got accepted into a pediatric dental residency where we continue to be educated specifically in pediatric dentistry for 2 to 3 years.
We learn a lot of advanced behavior management techniques, whether that's just different ways we talk to a child or advanced techniques like IV sedation or general anesthesia, ways that we can provide care for kids that will be helpful to be able to have them have the best care possible.
Right, because a lot of our training is creating really positive experiences for them, but also making sure we complete the dental work that they need safely so that we're ensuring that their smile and their oral cavity grows in a healthy way. You really want to create positive experiences so that they grow up learning to love coming to the dentist, not fear coming to the dentist, and so that's a really big part of what we do.
So the American Academy of Pediatric Dentistry recommends that the first dental visit for a child be at age 1 or when their first tooth erupts. Most of the visit is spent doing anticipatory guidance and speaking to the parents about how we can best prevent cavities, how we can monitor growth and development.
A lot of parents have questions regarding what type of toothpaste they should be using or how they should be brushing. And again, those are things that you really need to know right when your kids do first get their teeth, because there's going to always be bacteria in the mouth, and keeping the teeth clean is really important to prevent cavities. But also we see infants a lot sooner depending if there is any type of oral restriction or tie in the mouth.
We see so many babies who have lip, tongue, and cheek ties that are actually inhibiting a baby from nursing properly, or moms who are having a painful latch. There are implications even from an infant and newborn standpoint where it is important to actually visit a pediatric dentist who specializes in the diagnosis and treatment of oral restrictions like lip, tongue, and cheek ties.
As soon as your child gets a tooth, you should be brushing your child's teeth. I know that seems really crazy because some babies are like 3 or 4 months old getting teeth, but as soon as that tooth comes in, it's exposed to bacteria, it's exposed to acids and sugars. Seeing a pediatric dentist would also be helpful at that point because we can guide you in appropriate techniques, but also flossing is a great question that we get a lot, and sometimes as soon as babies get 2 teeth and they're touching, they need to be flossed, and that could be really early. Parents will also ask if they should be using a fluoride toothpaste for their child at this age, and as soon as your child has their first tooth, you can brush with a very small amount of fluoride toothpaste, like the size of a grain of rice. And that is totally safe.
It's one of those things where parents will often skip it because it is a little bit challenging, especially into those toddler years. But every kid is a little bit different. Every night in your house is a little bit different. So there's definitely different ways to brush your child's teeth successfully and actually still make it a positive experience for your child. And again, those are all things we can coach you on when you come visit us too. Well, I hear a lot, I don't have a toothbrush, or we don't have floss, or we ran out of floss, or we ran out of toothpaste. I mean, sometimes it's actually true, and we are happy to provide. We always give, families their toothbrushes when they come in. The kids are so excited because maybe theirs is worn out, they don't want to use it anymore. I think that's truly happened sometimes.
Yeah, definitely. I think we see a lot of little kids, and so parents really should still be brushing their teeth.
Yes.
And so not a lot of excuse necessarily from the child.
Yes.
I think that more so that it's challenging for the parent to brush the teeth, so they're not doing it because they don't want to scare the child or traumatize the child.
It's hard being a parent. At the end of the day, it always falls on us, whether your child is 2 or 15 years old.
Yeah, that's true. That's true.
But that's why it's so important, starting these habits so young and creating that importance for your child. As parents, we are more expert at brushing teeth and flossing teeth, and that's why it's really important we play a role in that process for our kids, really no matter what their age.
A really common question that we get probably daily at the dental office. A lot of people don't know that cavities on primary teeth are caused by bacteria. It's a strep bacteria, so we all know strep throat is infectious and contagious, and it spreads from tooth to tooth, and it can spread deeper into the tooth, but it can actually get into the bloodstream, and it can go to the brain or to the heart. There are some children who have died from tooth infection, from sepsis, and so we don't really mess around with tooth decay. We like to catch it early. We like to fix it when it's small because, again, we can provide those positive experiences for kids by placing small fillings or sealants on the teeth. And oftentimes, even as it gets a little larger, we can still restore those teeth with whether it's a full coverage crown or a larger composite material. Once you have to extract a baby tooth, it can definitely impact how those jaws grow and develop. You may be spending a lot of money down the line with an orthodontist, potentially needing jaw surgery. There's a lot of complications that can happen. Baby teeth are very important for the development of the bones in the jaw, and they're also very important for function, for eating, for chewing. When kids are in pain, they're not going to be necessarily sleeping well, doing well in school, so you don't want it to get to that point either.
That bacteria that's now, affected that baby tooth, it's actually affecting the adult tooth as well. So if you leave an abscess of a primary tooth in the mouth, it actually affects the development of that permanent tooth. They either don't ever come into the mouth because the whole process of their development was disrupted by that abscess, or the tooth comes in malformed, misshapen, discolored. Often that tooth either immediately needs treatment once it erupts into the mouth, or sometimes it actually needs extraction as well. So it is really so important to, again, be following up with the dentist and treating things early and conservatively. Parents often ask for tips on how to get their child excited about brushing their teeth. Sometimes it's as simple as, having two options for a toothpaste they're gonna use that night, or which toothbrush they're gonna use that night. Kids really, really like options. They like to make a choice. They like to be involved in the process. They don't wanna just be told they have to do something. I think we all are aware of that as parents. Sometimes we benefit from little songs and videos. Once you're done singing the song, the child knows you're done brushing their teeth. That can definitely be helpful as well.
Sometimes it's having the child lay on the floor, lay on the bed, lay on the couch so their head is against something and, brushing their teeth that way. It doesn't always have to be at the sink in front of the mirror like you or I maybe do. There are a lot of different ways that we can get it done safely and effectively, and again, still not traumatizing the child, still creating a good experience and making sure that it's done well.
Yeah, and some kids really benefit from the toothbrushes that light up or vibrate or spin, and anything that's gonna make or help your child like and enjoy brushing their teeth is good. It's a win. Finding a time in the morning or at night that works for you and your child and your routine can be helpful too, so kids know what to expect and are prepared for it too.
Well, one thing that's really interesting about little kids is how often we see trauma. It's a panic moment as a parent. I've even had it with my own kids where the first thing I do is check their mouth when it's bleeding. It's not something that needs to be handled by an emergency room, thankfully. Many times when we get these calls on the weekend, it is thankfully something that can wait until Monday. But it's important that we can give parents that reassurance and also give them instructions on, how to manage the situation themselves too.
I think another thing that we see a lot that you wouldn't see in an adult dentist is non-nutritive sucking habits. So whether that's a child that uses a pacifier, which is obviously very common, or sucking their thumb or their fingers, the general consensus is trying to discontinue the habit by age 3 if possible. We start to see a lot of jaw growth and development changes by that point. But obviously in every child and every family, there are different reasons that maybe that habit is extended a little bit longer. And as pediatric dentists, as people that see this on a routine basis, we can give some tips and tricks for maybe discontinuing the habit, or maybe point you in the right direction if we need to start getting some orthodontic involvement and things like that. So that's also something that we really see commonly in kids.
Definitely. We run into a common question too, and something a lot of parents ask about is tooth grinding. And that can be related to sleep disordered breathing, and it's something we're screening all of our patients for, but we're always asking questions, and more than a fourth of the population does have some type of oral restriction, whether it's a tongue tie, a lip tie, buccal, or cheek ties. And again, if you catch them early, it can be a huge impact for the child as it relates to airway development, jaw development, sleep patterns, patterns and habits. But there's a lot of dental issues besides just cavities that pediatric dentists especially are screening for and looking for at every exam visit.
So those were some of the most common questions that we get as pediatric dentists. Thanks for watching.
Yes, and if you're looking for a pediatric dentist, or if you have further questions or other questions, we're here to help and we're happy to help. So you can check out our website or you can give us a call.